Hello, I'm Whitley Yee, reporting at the FIP World Congress in Seoul. Today I'm with Trudi Hilton from the University of London. Trudi, you have been working on efforts to help ensure quality medication during disaster relief efforts. Could you speak a little bit about your work in this area?
Thank you. Yes, having worked in the UK health system for many years, I've started working in a resource-poor environment, particularly in response to disasters and emergencies, natural and man-made disasters. And I've begun to understand better how fractured the supply chain for pharmaceuticals becomes in these settings. There's many risks associated with managing medicines. It's not easy to procure and supply medicines in the best of conditions, but what we see in disasters is the door is open to a lot more risk of substandard and counterfeit medicines.
What is the biggest impact of substandard medications?
It's a good point, because substandard is actually in some ways more problematic. They're often made in a formulation that may not have sufficient active ingredient, or it may not have active ingredient at all. It may be in some way contaminated, and the risk is both to response to treatment, people don't get better well, and also there's a risk that if it's contaminated it will adversely affect health. The problem with substandard medicines is it's a very easy market for people who have unscrupulous manufacturing approaches to be able to flood the market with a product that's cheap to make and can have big financial rewards. But the impact on health is very significant. When you're working in the field, it's almost impossible to be able to analyze the product to know whether or not the quality that you require is there.
So what do you see as the role of the pharmacist in this effort?
Pharmacists are an essential member of any pharmaceutical supply chain in any program, most of all in settings where resources are poor. We need to be able to confirm the quality right from production through to patient. So that's not only that the manufacturer has everything in order and follows good procedures for manufacturing, but it covers also distribution, storage and handling to ensure the conditions are maintained for optimal quality of the product, and right through to making sure the patient gets the right product at the right time, that they understand what they're taking, that it's in the right language, that the dosage is clear. All of those aspects are elements of pharmacist knowledge and skills. So a pharmacist in that supply chain really improves the quality and the outcomes for that program.
What advice would you give to somebody who wants to donate medications to a disaster relief effort?
This is a really important point. I think there are lots of things that we can help with and donate, maybe clothing or blankets, but when it comes to medicines, the risks of not bringing the right product to the right setting are great. So my recommendation would really be to link up with other agencies that have the knowledge and skills, the expertise in place to be able to deliver medicines in a disaster. And then to look at the WHO guideline for donation of medicines. It's really explicit that it must be based on the needs, requests by the receiving agency, not based on what we have to give them, not based on our surplus or our short-dated medicines that we want to get rid of, but explicitly responding to the needs of the recipient in terms of the quality, the type of medicine and the quantity of medicine that they require, that we only donate what is actually explicitly needed. We have evidence of vast quantities of medicines left over, particularly after the Asian tsunami. It costs $5 a kilo to destroy these medicines, and sometimes they get into the wrong hands and they can be damaging to communities. We know that until we manage the donations well, this continues to be a problem in both natural and man-made disasters.
Lastly, what regulations are currently in place to help prevent this?
It's a good point, and we've seen a lot of governments, a lot of national regulatory agencies introducing and improving their standards for ensuring only quality medicines come into a country. And we recommend, we applaud these efforts. We can see that there's a real intention to ensure that medicines are only manufactured and received and imported of a particular quality. And many donors like USAID are also setting standards for implementing partners to ensure quality. So the regulations are coming. There's an awareness that's being generally around the world, a real increase in awareness of the need to ensure quality, and regulation by national agencies supported by expertise from pharmacists is making a big difference.
Thank you so much. This is Whitley Yee reporting from FIP.